So here we have Kitty, who has now been sedated. You can see there's an endotracheal tube, so Kitty's receiving gas anesthesia and oxygen, and she's being monitored. Everything is going well. And what we can see is there is this major wound here with all the bruising around it. Now, some people will just look at this and say, oh, it looks like it could heal, and it's superficial, but when you actually explore it, you can start to see that there's a big hole underneath, okay, and there's a lot of tissue that's exposed all the way around there underneath there. Now, this is tissue that's under the skin called subcutaneous tissue. There's also muscle exposed here, so that's why we need to open this up, flush it out, and place some drains to allow any infection that's still trapped in this pocket to come out over the next few days. So now what we're doing is we are prepping the wound and cleaning it to get any contamination of bacteria off of the skin, so that when we go in there, we don't introduce any type of infection underneath. So now we have this cat who has been prepped, and what we're doing here is using some sterile saline to go into the wound and flush anything that's out of there out. So we get any of this infection out of there. You can see it's coming through some of the other holes that were made by the trauma from the other animal that we don't know exactly which other animal was attacked this cat, because this wound is quite large. So now I've flushed out this area here, the wound under the skin, with sterile saline. You can see when I insert these forceps that you can see how deep this wound goes underneath. There's just all tissue here underneath the skin that has been flushed out, and it's quite a large pocket, so we're going to place some drains here next. So now I made a hole here in the skin where the pocket ends, because I'm going to take my drain through here. I'm going to make another hole over here, and that's where my drain will go through. Okay. So now I have my Penrose drain, and what I'm going to do is I'm going to clamp it from one side. I'm going to take it all the way through this wound to the other side. And that'll take the drain all the way through where I want it to be. So now we've placed 2 Penrose drains here, and when I flush through here, there's going to be a lot of drainage coming out of all these drains, and that's the whole point, is we want to get the infection out of there, okay? And we don't want it to stay inside, because the infection is not going to let these tissues underneath heal properly, and these drains are going to help this infection continue to come out over the next few days, and you'll see what we're going to do for this kitty over the next few days as well. Okay, so we finished the procedure, and now Kitty is resting comfortably. She's being surrounded by warm air. She's waking up to make sure she stays nice and warm. When she's recovering from her procedure, she's been extubated, and she's on IV fluids. You can see here our IV fluid pump is running, and she's also attached to this bear hugger that's keeping her nice and toasty.